Hello and welcome to my histology series. The video in focus will be looking at the organs associated with the gastrointestinal tract. That is going to be the pancreas, the liver, and the gallbladder. Right. The first segment we have a discussion on what the organs look like. Then the last segment we have a look at the slides of the different organs. Right. So the pancreas has both exocrine and endocrine tissue. Most of the tissue is going to be exocrine. Then you also have islets of Langerhans, which are going to be the endocrine tissue. Right. So the exocrine pancreas is made up of secretory units which are acinar or tubuloacinar in shape, and they're going to be formed by a simple epithelium, which is going to have pyramidal serous cells. Right. And those pyramidal serous cells are going to be drained by an intercalated duct. The intercalated duct in the pancreas is unique in that it actually starts within the acina, and you're going to have central acina cells. Histologically, the pancreas resembles the parotid gland, which is the largest salivary gland. And there are going to be four major differences, two that are unique to each. So if you look at the parotid will lack islets of Langerhans, which are the endocrine tissue in the pancreas. And the parotid will also lack the central acinar cells that I say they belong to the intercalated duct that would have started within your acinas. Right? Then if you look at the pancreas will lack striated ducts. It will also lack myoepithelial cells. For you to be able to secrete pancreatic contents, we depend on secretin and CCK. Right? Then if you look at the cells that are going to be in the pancreas, they're going to be characterized by an apical acidophilic appearance due to the presence of the zymogen granules, as well as basophilic basocytoplasm. Right? And the zymogen granules actually become more apparent in fasting. You will actually be fasting because you won't be releasing the stored enzymes. Right? Then the central acinar cells that I described to belong to your pancreas, these central acinar cells are actually going to be squamous, right? And they lack the secretory granules that are typical to the other cells that you find in the pancreas, right? Then if you look at the duct system, the first duct will be the intercalated duct, which has simple squamous epithelium. Then you find the intralobular, which then drain to interlobular, which have an increasing simple columnar epithelium. When I get to the slides, I'm going to show you an intralobular duct. Right? Then the intercalated duct actually has the ability to add bicarbonate and water to the exocrine secretion of the pancreas. Right? Then for you to be able to secrete these pancreatic contents, remember we said you'll be under hormonal influence as well as neural influence, and the hormones particularly they're going to be secretin and CCK. Right? Then the endocrine tissue within the pancreas, it's a diffuse system, which is another part of the diffuse neuroendocrine system, which you find in the respiratory system. If you haven't watched the video on the respiratory system, there's one on the series, as well as the small intestines and the stomach. We also find the neuroendocrine, diffuse neuroendocrine system, the DNES, right? So it is believed that the endocrine tissue within the pancreas makes up about 2% of the volume of the pancreatic tissue, and most of it is found within the tail of the pancreas. Right? And the cells that you find there, you have the alpha cells, popularly known as the A cells, you have the beta cells, popularly known as the B cells, you have the delta cells, popularly known as the D cells, then you have the PP cells or the F cells, which produce pancreatic polypeptide. The D cells are known for producing somatostatin. The beta cells are known for producing insulin. Then the alpha cells are known for producing glucagon. Right? And in an H&E stained preparation, it is quite hard to separate those cells. But if you use a special stain to separate them. That is going to be Zenka Formo and Mallory Azan stain. You'd find that the A cells appear red, then the B cells will appear a bit brownish, then the D cells will appear a bit bluish. That's how you can separate them, right? Then if you also look at some of the minor cells within these islets, you find there's a D1 cell, which is for vasoactive intestinal peptide and physiology. Then you also find the EC cell, which produces substance P and some of the motilin and secretin. Then you also expect to find the epsilon cell for ghrelin, right? And that ghrelin will actually go and stimulate appetite, right? Then you also remember that the B cells are implicated in diabetes mellitus, which is your type 1 diabetes mellitus, right? And a problem or an autoimmune condition that affects your B cells will result in diabetes mellitus, which is type 1, right? Then moving on to the liver will be the largest internal organ, and it weighs almost 1.5 kg, and that's almost nearly 2.5 to 3% of the total body weight that you expect in an adult. And your liver is going to be completely covered by a capsule known as the Gleason's capsule. However, it is not completely covered by peritoneum because the region that is in direct contact with the diaphragm, you have a bare area where the peritoneum will actually not line, right? And if you look at the liver histologically, you can divide your liver into zones or functional classifications, if I may say. Right? And structurally, the liver will have the liver parenchyma, which is the functional parts of the liver, where you have organized the hepatocytes, which are organized into plates, right? Then you also talk about the connective tissue stroma, which is continuous with the Gleason's capsule on the outside. Then you also talk about the sinusoidal spaces, where we'll see blood in the artery and the veins mixing. Then we also talk about the perisinusoidal spaces, which will lie between the endothelium of the sinusoids and the hepatocytes basally. Right. So structurally, like I said, there are 3 ways to describe the structure of the liver. There is the classic liver lobule, then there is the hepatic asanas, then there is the portal lobule. Right. To begin with, the classic liver lobule, number 3, the classic liver lobule consists of stakes of anastomosing hepatocytes, which are going to be 1 cell thick, and they're separated by a sinusoid, right? And this classic liver lobule simply describes the flow of blood within the liver, which is going to be centripetal. There's a centripetal flow of blood in the liver, simply meaning that blood will move from the periphery towards the central vein. If you look at the flow of bile is going to be centrifugal. It moves from the center to the periphery. That's a centrifugal flow. But that's what we're going to describe with the portal lobule. If you look at the classic liver lobule, we are describing the flow of blood from the periphery towards a central vein that is at the center. Right? And at the edges, you find a portal triad that I'm going to show you. Right? And that at that portal, where you find that portal triad, there is a small space known as the periportal space, or the space of Moore. Within that space of Moore, that is where it is believed that most of the lymph in the liver will actually originate. Remember, the liver produces almost 1/3 to half of the lymph in the body. Right. Then you then look at the portal lobule. This describes the exocrine function of the liver. By the way, the classic liver lobule is going to be hexagonal in shape. The portal lobule is triangular, and it describes the exocrine function of the liver, which is biosynthesis on the apical end. Bile is synthesized and by the hepatocytes and secreted into what are known as biocanaliculus. Biocanaliculus will simply be spaces between adjacent hepatocytes, and that bile secretion on the apical end of the hepatocyte is described by this portal lobule. And remember, I said bile has a centrifugal flow from the center to the periphery, right? Then there is the liver asanas, or the hepatic asanas. The hepatic asanas is the structural unit that gives you the best correlate between liver function, blood supply, pathology, and metabolic activity within the liver. It simply describes the oxygenation of the liver, right? And in terms of shape, older texts would say it's diamond shaped. Newer texts would say it's lozenge shaped, right? And it represents the smallest functional unit of the liver, or basically of the liver parenchyma, right? And you divide the liver into zones. There's the zone that is closest to the periphery, which is zone 1. Then there's the zone that is closest to your central vein, which is zone 3. Then there's an intermediate zone between the two. Cells in zone 1 receive most of the oxygen, and yes, they'll be specialized for protein synthesis. So expect those hepatocytes to have abundant rough endoplasmic reticulum and so forth, right? And cells in zone 3 receive least oxygen. They're the ones that are specialized for lipid metabolism. Those cells in zone 3, they don't have distinct or sharp boundaries within that zone, right? So coming back to then zone 2 is the intermediate. It lies between the two zones. If you look at zone 1, cells in zone 1, like I said, they receive the oxygen first, they get the nutrients first, they get the toxins first that is going into the liver, right? And they're the first to show changes if you get cholestasis, those cells in zone 1, right? But if you get tissue hypoxia, they are the last to be impaired or to undergo necrosis, right? And they're also the first to regenerate, right? When we get to the biocanaliculi, I'll mention something of some stem cells that are found within those biocanaliculi that are thought to be there in the biocanaliculi to give rise to new hepatocytes, right? Then cells in zone 3, they are the first to undergo central lobular necrosis in cases of hypoxia, right? And they're also the first to show fat accumulation, those cells in zone 3. Right? Then if you get toxins, cells in zone 1 will be the first to be affected. Right? Then coming back to the middle of the board, remember blood supply in the liver is divided into two. 70% of the blood in the liver comes from the hepatic portal vein. Then 30% comes from the hepatic artery proper. The hepatic portal vein is formed behind the neck of the pancreas by union of the splenic vein and the superior mesenteric vein. Whereas the artery, which you said brings 30% of the blood, the hepatic artery proper, it's a branch of the celiac system. Remember, the celiac artery would emerge from the aorta at around T12. That will give you three major branches: the left gastric, the splenic, and the common hepatic artery. The common hepatic artery would give you right gastric. It would also give you gastroduodenal. It would continue as the hepatic artery proper, which would later divide into the right hepatic artery and the left hepatic artery. The right hepatic artery would also give you the artery of the gallbladder, which is going to be the cystic artery. Right. So blood in those two vessels, or the smaller vessels that emerge from the vein and the artery, it will mix in the sinusoids. Right. And the sinusoids are lined by a thin, discontinuous epithelium. Right. And that thin, discontinuous epithelium will also have endothelium rather, will also have a certain type of cell found within that sinusoid, which are going to be your stellate macrophages or stellate sinusoidal macrophages, popularly known as the Kupffer cells or the Kappa cells, depending on pronunciation, right? Then blood from the sinusoids gets to the central vein, also called the terminal hepatic venue. Then from the terminal hepatic venues, you get to the sublobular veins. Then from the sublobular veins, you get to the hepatic veins that then drain to the IVC. Remember, your IVC would be the major support of the liver, right? Then the Kupffer cells, since they are macrophages, they're also seen to be having a function of removing all red blood cells, which normally is the function of the spleen. But to some extent, you also have the Kupffer cells doing that. Then between the hepatocyte and the sinusoid, remember I said there's a perisinusoidal space, also known as the space of Dis. Within that space of Dis, you find stellate cells known as itocells. Itocells store fat and vitamin A, but in pathology, those itocells can become transformed to become myofibroblast-like cells that secrete collagen in the space of Dis, specifically in things like liver cirrhosis and so forth. Right? So that can be a very good concept in pathology. Those itocells will simply become transformed to become myofibroblast-like cells. Right? Then the basal end of the hepatocytes will have microvilli that project into this perisinusoidal space. Those microvilli are going to be small and irregular, and they actually project into your perisinusoidal space, where they're going to absorb the nutrients, the toxins, everything from the gut, the drugs, and so forth. Right. Then, so we say that the functional cell in the liver will be the hepatocyte. They're polarized just like epithelial cells with an apical end and a basal end. Then we say the apical end is specialized for the production of bile, and the basal end does everything. They have abundant rough endoplasmic reticulum, Golgi apparatus, mitochondria, smooth endoplasmic reticulum as well. Then we say the apical ends are specialized to secrete bile to the canaliculi. Then the bile canaliculi are drained by the canals of Hering, which are lined by cholangiocytes. Those cholangiocytes are going to be simple cuboidal epithelial cells. Then from the canals of Hering, you get to the bile ductus, which have a simple cuboidal to columnar epithelium. Then the ductus join to form the hepatic ducts. Then the hepatic ducts merge to form a common hepatic duct, which upon exiting the liver at the porta hepatis, it joins the cystic duct, and they form a common bile duct, which you remember we join the pancreatic duct to open at the major duodenal papillae as an ampulla of Vater. Right. Then the basal end of the hepatocyte, like we said, is irregular microvilli which path the space of this, your perisinusoidal space. Right. Then if you also look at those hepatocytes, they're quite large and they're polygonal cells which measure almost 20 to 30 micrometers, and they make up almost 80% of the cell population in the liver or the liver parenchyma, right? And they're going to have inclusions which are going to be glycogen granules that I'm going to show on one of the slides that I'm going to show towards the end of this video. Right. And you also expect numerous peroxisome within those hepatocytes. Right. So you have peroxisomes and that are also going to be numerous. So you expect rough endoplasmic reticulum, smooth endoplasmic reticulum, and so forth. Right. But lastly, there's the gallbladder. Right. The gallbladder is P-shaped. It has a capacity of 30 to 50 mils. It's going to be about 7 to 10 centimeters in length, and that gallbladder simply stores and concentrates bile. It doesn't produce the bile. Right. Then it has a body, a neck, and a fundus. The neck continues as the cystic duct. that you remember from your gross anatomy. Right? The mucosa of the gallbladder, like I'm going to show on the slides, it's folded. Their mucosa folds, right? And the epithelium is going to be a simple columnar epithelium. The simple columnar epithelium will also have microvilli, but the microvilli are not well developed in the gallbladder. Right? Then you also expect concentrations of mitochondria because they're going to have some ion exchange occurring within the epithelium of the gallbladder. Right? Then the lamina propria is rich in fenestrate capillaries. You find venules. Then you lack muscularis mucosa and submucosa. You also lack goblet cells. Right? But mucin secreting glands may be present in the gallbladder. Right? Then, so remember, you lack muscularis mucosa and you lack the submucosa. Right? Then you find the muscularis externa. The muscularis externa will have cells that are not somewhat arranged into the normal arrangement that we find in the GIT, which is the outer longitudinal and the inner circular, right? And that muscularis externa will also have elastic fibers and collagen fibers predominating within the muscular externa. Right? Then you have adventitia, then you have serosa. Adventitia, where the gallbladder is in contact or attached to the liver, then serosa, where it is not attached to the liver, right? Then you find deep diverticula in the gallbladder of the mucosa known as the Rokitansky arc of sinuses, which I'm also going to show on the slides that I'm going to project for the gallbladder, right? And those are thought to be showing the presence like the presence of some pathologic conditions which will be as a result of hyperplasia within the gallbladder. And like I said, since it's involved in concentrating the bile, you find aquaporins within the gallbladder, specifically aquaporin 1 and aquaporin 8, right? All right, so this is liver tissue, right? These are the one cell thick hepatocytes are arranged around the sinusoids, which are those empty spaces there. Right? And if you look at this, that's a central vein, meaning all this will be demarcations of a liver lobule. Right? That's a portal vein, right? Then these here are bile ducts. So those are your bile ducts. That's the hepatic artery. That's another portal vein. That's another portal vein. Then there's another bile duct. If you look at this insert here, this is a hepatic vein, right? This is a hepatic vein. Then that's lymphoid tissue. That's a lymphoid nodule. Then here we also have a smaller artery. Then this here, this is now connective tissue. Right? Then if you look at it at a higher magnification, that's a central vein. These are hepatocytes. Those are the sinusoids, the spaces, empty spaces between the hepatocytes. Right? And then these peripheral ends, you find a portal triad. This specifically, this is a bile duct. That's a bile duct. That's a bile duct. That's another bile duct. Remember, I said bile will actually flow in a centrifugal manner from the center towards the periphery, right? Then, if you look at it at an even higher magnification, that's a central vein. Those are the endothelial cells that I mentioned, right? Then these are your sinusoids. That's a sinusoid. There's an example of a Kupffer cell in the sinusoid. Remember, these are hepatocytes. That's a Kupffer cell. Then that's another sinusoid. That's a sinusoid. That's another example of a Kupffer cell inside the sinusoid. All these are sinusoids. Those are Kupffer cells inside the sinusoids. Right. Then that's a hepatocyte. That's a hepatocyte. The space there, the space that is between those two hepatocytes there, that's a biocanaliculus. If you look at this hepatocyte and that hepatocyte, there's also that space there. That's a biocanaliculus. Right. And if you look at this one, that's a sinusoid. That's an endothelial cell. Right. That's a Kupffer cell inside the sinusoid. These are hepatocytes. Right. Those spaces there are your biocanaliculi, the spaces between the hepatocytes there. Right. Then if you look at these granules, these are lipid droplets now within the hepatocytes. Right. So all these, they are lipid droplets. Then what else can we see here? That's another sinusoid. Right. Then this is gallbladder tissue. This is the mucosa which is folded. And remember, we said there is no submucosa in the gallbladder. This here, this is smooth muscle. Right. Oh, this is smooth muscle. Right. Then those are your sinuses, the sinus that I just mentioned when I talked about the gallbladder. These ones, they're going to be your Rokitansky Askov sinuses. These ones. Then what else can we see here? These are plasma cells and some lymphoid cells, and that's the epithelium. Right. That's another Rokitansky Ashov sinus. Right. Then these are blood vessels. There's a blood vessel there. Then this is connective tissue, making up the adventitia on the outside here. Those are the blood vessels. That's a blood vessel. That's a blood vessel. That's a blood vessel again. Right. Then that's a mucus producing gland. And those are the mucus cells. Right. Then this is another form of epithelium folded. Right. And this at the center there, that's connective tissue. Just loose, you can see by the presence of an equal proportion of cells to the fibers. Then there's an example of a blood vessel. Then this is pancreatic tissue. Like I said earlier, when I'll show you an intralobular duct, this is an intralobular duct. Right, that's a blood vessel. Right, this is connective tissue, the septa that divides it into lobules. That's connective tissue. These lightly stained regions here, those are islets of Langerhans. And the rest, this is Asanas tissue. Right. Where you find the islets of Langerhans, there should be a blood vessel close, right? Because endocrine organs secrete into the blood. Right. At higher magnification, there's an asana. Notice there's a central asana cell inside. Right. There's another asana. Notice there's a central asana cell inside the cells of the intercalated ducts. Right. Then if you want to see the ducts themselves, these are intercalated ducts, these ones. The ones that drain the asana. That's an intercalated duct. Right. Then that's another intralobular duct now. It's a bit larger as compared to the intercalated ducts. So these intercalated ducts will go to the intralobular duct here. So that's pancreatic tissue, and you see this asana. And you don't see the striated ducts that we said are in the parotid, and you also don't see your myopithelial cells. That's just about it.